You hear it constantly. Serve your time, and you've earned free health care for life. It's the promise whispered in recruiting offices, the assumed safety net when you finally take off the uniform. But if you believe VA healthcare is a simple, all-inclusive, no-cost guarantee, you are missing the single most crucial piece of the puzzle, the part they absolutely do not explain when you transition out. The truth is, the VA system is less a blanket guarantee and more a complex, multi-tiered labyrinth where the term free applies only to a select few, and even then, it comes with significant caveats, hidden costs, and administrative burdens that can last decades. We're going deep into the reality of VA healthcare, revealing the eligibility traps, the priority group maze, and the financial hurdles that turn the promise of lifetime care into a lifetime of navigation. If you are a veteran or planning to be one, this information isn't just helpful. It's essential for your financial and medical future. The biggest misunderstanding, the foundation upon which the myth of free healthcare crumbles, is the concept of service connection. Many veterans assume that because they served honorably, they automatically qualify for comprehensive, zero-cost medical care. This is the eligibility trap. In reality, access to truly free health care is fundamentally tied to whether your current medical conditions are officially recognized as having been caused or aggravated by your military service. If you are rated 50% or more service-connected disabled, congratulations, you have largely unlocked the golden ticket. Your care for all conditions, service-connected or not, is generally free, and you are exempt from co-pays and premiums. But what about the vast majority of veterans who leave service with zero or low service connection? If you are rated 0% or 10%, or if you haven't applied at all, you are immediately dropped into the complex world of means testing and priority groups, where free is a dangerous misnomer. Without that service connection rating, your eligibility becomes contingent on your income and your medical history, forcing you to prove financial need just to access the system. This distinction is the single greatest determinant of your medical benefits, yet it is rarely explained with the urgency it deserves during the transition process. It's the difference between walking into the clinic with confidence and walking in with your checkbook ready. This brings us directly to the copay conundrum. When free still costs money. Even if you are eligible for enrollment in the VA system, that doesn't mean your visits are free. For veterans who are not service-connected for a specific condition or who fall into the lower priority groups due to higher income, the VA implements a structure of co-payments that can quickly add up, turning your assumed benefit into a significant annual expense. These costs are broken down into three main categories: primary care visits, specialty care visits, and medication co-pays. For primary care, you might face a modest charge, but specialty visits, like seeing a cardiologist or an orthopedic surgeon, carry a higher fee per visit. And let's not forget the inpatient hospital stay co-pays, which are calculated based on a percentage of the Medicare deductible and can be substantial, especially for extended stays. These fees are not fixed. They are subject to change annually, meaning the cost structure you learned this year might shift next year. Furthermore, the billing process can be delayed, leading to surprise invoices months after the fact, creating financial uncertainty. Many veterans avoid seeking necessary treatment because they fear the unpredictable bill that will arrive later, effectively creating a financial barrier to care that the system was supposed to eliminate. The VA uses these co-pays to help fund the system, essentially shifting the cost burden onto those veterans deemed financially capable, a detail often glossed over when discussing the lifetime benefit. The complexity deepens when we examine the priority group maze. Why your place in line matters. The VA doesn't treat all enrolled veterans equally. They categorize everyone into 8 distinct priority groups. This tier system determines not only if you can enroll, but also when you can be seen, what services you receive, and if you pay co-pays. PGs 1 through 5 generally receive the most comprehensive care and often have lower or zero co-pays. primarily consisting of veterans with high service connection ratings, PG1, or catastrophic disabilities. But if you fall into priority group 7 or 8, typically veterans with no service connection and higher incomes, your access is severely restricted. In fact, enrollment in PGs 7 and 8 can be frozen entirely during periods of budgetary constraint, meaning you could be eligible one year and denied the next, regardless of your medical need. This structure creates a fundamental divide. Those with high service connection are guaranteed access and comprehensive care, while those without are subject to the whims of the annual budget and enrollment caps. Understanding your priority group is crucial because it dictates the quality and speed of your access. If you are in a lower group, you might face significantly longer wait times for routine appointments, pushing you back into the private sector or forcing you to delay necessary care, which is a hidden cost in itself. Beyond the service connection and priority groups, there is the hidden cost of means testing, income limits, and financial disclosure. For veterans who do not qualify based on a high service connection rating, PG 1 to 5, the VA uses a financial assessment or means test to determine eligibility for enrollment in the higher cost PGs, PG 7 to 8, and whether copays apply. This is where the VA requires you to disclose your previous year's gross household income, including income from all sources, not just wages. If your income exceeds the established threshold, which varies based on your geographic location and the national average, you are automatically placed in the lowest priority groups and subjected to mandatory copays for most services. This process feels intrusive and punitive to many veterans who earn their benefits through service regardless of their current income. It fundamentally transforms the benefit from an earned entitlement into a government assistance program based on financial need. For veterans who are just above the threshold, this creates a frustrating scenario. They make too much money to qualify for free care, but still face significant out-of-pocket costs compared to their service-connected peers. Furthermore, any change in income, such as retirement or a new job, requires reassessment, meaning your healthcare stability is tied directly to your annual earnings report. Let's turn our attention to the prescription paradox, medications, and the formulary fight. Even when your care is deemed free, getting the medications you need can become a bureaucratic battle. The VA operates based on a national formulary, a list of approved drugs. If your provider prescribes a medication that is not on the formulary, you and your doctor must engage in a lengthy, non-formulary request process, providing extensive justification as to why an alternative formulary drug won't work. This process can cause significant delays in starting critical treatments, sometimes taking weeks to resolve. While the VA's medication copays are often significantly lower than private insurance copays for those who must pay them, the sheer administrative effort required to access specialized or cutting-edge drugs is a major hidden cost. Moreover, the VA often mandates mail-order pharmacy services for long-term prescriptions, which is convenient for some but problematic for veterans needing immediate refills or specialized delivery. This formulary restriction means veterans often receive the standard, cost-effective treatment rather than the newest or most personalized option available in the private sector, leading to a perceived disparity in the quality of care, even if the EI outcomes are comparable. Access is another major hurdle, especially regarding specialized care and wait times. The reality of access. While the VA aims to provide comprehensive care, the system is notoriously strained in certain areas, leading to significant wait times, particularly for non-urgent specialty care appointments, mental health services, and especially dental care. For most veterans, dental care is explicitly excluded from VA benefits unless you are 100% service-connected disabled, or the dental issue is directly related to a service-connected condition. This means the majority of veterans must find and pay for private dental insurance or care entirely out of pocket. a massive mandatory expense not covered by the free health care promise. For mental health, while the VA has expanded services, demand often outstrips capacity, leading to long waits for initial appointments or specialized therapy. While the Mission Act theoretically allows veterans to seek private care if VA wait times exceed certain limits, navigating the community care program itself is a complex administrative nightmare, often requiring multiple authorizations and creating friction between the VA and private providers regarding billing and record sharing. The true cost here isn't monetary. It's the cost of time, the cost of delayed diagnosis, and the emotional toll of bureaucratic hurdles when you are already struggling. We must also address the limitations imposed by non-service-connected care limitations, the "if it isn't SC" rule. If you are a veteran with a low service connection rating, the VA's priority is treating the conditions that are officially linked to your service. While they will provide general primary care if you are enrolled, the level of aggressive treatment and resource allocation often favors the service-connected conditions. For instance, if you have a 10% rating for a knee injury but develop a serious non-service-connected heart condition, your treatment for the heart condition is subject to the copay structure and the resource limitations of your priority group. The VA is obligated to provide excellent care, but the urgency and speed of access, especially for expensive or experimental treatments, are often prioritized based on the service-connected nature of the illness. This creates a psychological burden where veterans feel they must constantly link every ailment back to their time in service just to receive the highest level of comprehensive, free coverage. If a condition is clearly non-service connected, like a sports injury sustained years after discharge, the veteran must navigate the system as a lower priority patient, often facing the copays and the means testing limitations we discussed earlier. Finally, the ultimate hidden cost is the paperwork burden, the lifetime cost of documentation and appeals. Even if you achieve 100% service connection and truly free health care, the administrative burden never ends. Maintaining your benefits requires a lifetime commitment to paperwork, attending compensation and pension C and P exams, responding to proposed rating reductions, and potentially engaging in the lengthy, emotionally draining appeals process. The VA system is not set it and forget it. Your disability rating can be reviewed periodically, especially if it's not deemed permanent, meaning you must constantly prove your condition has not improved, requiring ongoing documentation from private and VA doctors alike. Furthermore, accessing benefits like specially adapted housing or aid and attendance requires separate, detailed applications, often necessitating the hiring of specialized legal help or veterans service officers. This continuous cycle of documentation, reevaluation, and the constant threat of losing benefits is an enormous non-monetary cost. It's the cost of chronic stress and administrative anxiety that accompanies the free benefit. The system demands vigilance, turning the veteran into a lifetime student of VA regulations just to maintain the care they were promised. So, what is the takeaway? The promise of free health care for life is a powerful recruiting tool, but the reality is a nuanced, complex system of earned entitlement based on service-connected disability and financial need. For those rated 50% or higher, the system works largely as promised, providing comprehensive, low-cost care. But for the millions of veterans with low or zero service connection, the VA is a safety net with holes, a system where copays, means testing, and priority group restrictions create genuine financial and access barriers. To truly maximize your benefits, you must understand that the key to unlocking the best VA care isn't just serving honorably. It is meticulously documenting and aggressively pursuing every service-connected claim you are entitled to immediately upon separation. Do not assume your conditions will magically be covered later. Understand your priority group, calculate your potential copays, and recognize that the cost of VA healthcare isn't always measured in dollars, but often in time, paperwork, and the emotional energy spent navigating the maze. The VA is a valuable resource, but it demands that you become your own most dedicated advocate.